There are so many different things that can cause back pain and numbness, and one of them is a spinal compression fracture. We've got board-certified neurosurgeon Dr. Jagannathan with us to talk a little bit about the condition, how and why this happens. Tell us about it.
So compression fractures are fractures of the vertebrae, a part of the spine. The weight-bearing part is called the vertebral body, and most commonly because of osteoporosis, the bones in there can become weak, and even as a result of minor trauma, they can collapse and cause fractures. Fortunately, these fractures are usually stable, meaning that they're usually not fractures that would paralyze somebody, but they can cause extreme pain.
Okay. So extreme pain, numbness. So you go to your doctor, get this diagnosed. How can this be treated?
There's outpatient. The initial treatments are usually non-surgical, things like bed rest, like analgesics, bracing. But in many cases, these don't fix the problems quickly enough, especially for patients that are used to being active. And there's an outpatient procedure known as a kyphoplasty, where basically we insert a balloon into the fractured vertebrae, expand the balloon, and inject some glue or cement to hold the vertebrae in place. That's extremely effective for pain. And for acute fractures, meaning fractures within 90 days, oftentimes more than 80 to 90% of patients will have benefit.
Wow. And how long does that last?
Usually, once you've treated it, it should be for the rest of the life of the fracture. Now, occasionally you can refracture either the vertebrae that was treated or additional vertebrae, and that really underscores the importance of preventative measures such as being on vitamin D, calcium, particularly in osteoporotic patients, and women after menopause getting bone density tests and things like that.
Okay, so they're the most at risk.
Those are the highest risk. There's also an association with certain types of cancer when they spread to the bone, but by overwhelmingly the most common thing that we see are patients who have osteoporosis.
Okay. And we do have one of your patients here. We've got Julie Schultz here from Mayo. Tell us, Julie, about your condition and how you determined what happened.
When I was 18, I was in a toboggan accident, and it caused a lot of trauma to the spine. And, of course, over the years, arthritis set in, and everything just got a little bit worse than what it was.
Okay. And so what was it, just pain? Was that the issue?
I had a lot of pain, and I also had where I couldn't walk at times. Life was very limited for me. There were so few things that I could do anymore, and that was depressing. Absolutely. Until I found Dr. J.
Okay. So tell us what happened. When you had that procedure done?
Yes, I did, and it was just wonderful. There was no pain. I rested for 2 days like he suggested, and it was just marvelous. I noticed the difference right away. And then when I had the second procedure done, which was where all the damage was, that just took a couple more days longer, but the recovery is just wonderful. And my outlook, I have increased circulation into my legs. I have no more nerve or bone-to-bone pain. So it's been a wonderful, wonderful experience for me.
Wonderful. Thank you so much for sharing your story. I appreciate it.
Thank you.
And if you want any more information about the kyphoplasty procedure or the condition, you can head to our website at 9and10news.com.
This Health in Focus is a paid segment by Jagannathan Neurosurgery.